We are back, dear viewers, from this report, and I think this interview is going to be very important for anyone that has children that are dealing with type 1 diabetes. So we've been joined by our first guest for this evening, Reem Almatrook, the clinical dietitian. Good evening, Reem, and welcome to Hala, Kuwait.
Good evening. Thank you for having me.
So in the beginning, you're a pediatrician dietitian, which is
pediatric dietitian. Yes.
Sorry, pediatric dietitian,
Yes.
which I think is really important, especially for diabetic children. And a lot of the time, parents don't know how to deal with the situation when it comes to the food or anything they should be doing. So what is the role of the dietitian in this case?
Okay, so basically, when a child gets diagnosed with type 1 diabetes, there's a lot to learn about their doses, about the food that they eat. The management of the disease is directly related to the food that they eat.
Yes.
So the better they understand the food, the better they understand how it gets digested, the physiology of it, the better the insulin doses they can have for their disease. So my role is to teach them how to count the carbohydrates in their food, because the injection of insulin that they take is calculated from the food that they eat.
Definitely.
So I teach them how to carb count. I teach them other mathematical calculations that they need to know in order to get the right insulin doses.
Definitely. There's a lot that does go into it, for sure. And a lot of people don't know that there's type 1 and type 2 diabetes.
Yes.
There's a big difference between us. So can you tell us about the difference?
Yes, both diseases are very often confused with each other. Type 1 diabetes is an autoimmune disease, which means the body's immune system attacks healthy cells instead of the unhealthy cells. And in the case of type 1 diabetes, it attacked the pancreatic beta cells, the cells that produce insulin. So then the person won't have insulin at all. It's called an insulin deficiency, and they would need to get it from the outside. So that's either an injection or an insulin pump in order for them to make energy from the food that they're eating. On the other hand, type 2 diabetes is called a progressive metabolic disease, which means there is insulin in the body, there's no insulin deficiency, but it's not working the way it's supposed to work. So in that case, the patient would need to undergo lifestyle changes or medications or even insulin injections.
Right.
So type 1 and type 2 are different in the way that they're caused, and they're different in treatment. The only thing they have in common is that blood sugar is uncontrolled. That's it.
Yes, and of course, as you said, parents should be very aware of the differences, because the medicine is different, the food is definitely different for both situations. So there's a lot of myths and misconceptions, we can say, when it comes to diabetes, and especially type 1. And it's said that eating sugar does cause type 1 diabetes. How true is that?
That's a very popular misconception. Type 1 diabetes is completely unrelated to the food intake of the patient. As we said before, it's an autoimmune disease. And unfortunately, this is a very popular myth. Even the children that I see in clinic have been blamed by family members and their peers that, oh, you got diabetes because you eat too much sugar. Of course, it's completely incorrect, and it's unfair and wrong to say that to the children who have type 1 diabetes.
I think that's very sad that all this pressure is being put on the little kids for something that's not in their hands. And another myth is that people with type 1 cannot eat sweets or sugar. Is that right?
No, because the truth is there are no special guidelines for children with type 1 diabetes that are different from children without type 1 diabetes. The guidelines are the same, which are basically sugar in moderation. We say it's better not to surpass 20 or 30 grams of sugar in a day, which can look like a cup of juice or a bar of chocolate. So it's important to keep in mind also there is something that we call hidden sugars. So some food products that we don't notice have sugar added in them. So these also we need to take into account into our daily sugar intake. And this is the same for someone with or without type 1 diabetes. And the people with type 1 diabetes, as long as they account for the sugar that they're eating and they count the dose correctly and they take it at the correct time, there shouldn't be a problem for them to eat sweets.
Definitely, and I think you mentioned something really important. We usually just count the sugar intake when it comes to actual sugary foods like sweets or
Yes.
desserts, and we forget that sugar is there in a lot of sauces and a
Yes.
lot of even bread has sugar.
Foods like cereal, flavored yogurt, soft drinks, many products have sugar added into them.
Definitely. So something we usually see with diabetic patients is the glucose measuring device, and I think it's very important for them, and every person has it if they're dealing with diabetes. Can you tell us about it and how it works?
Yes, it's called a continuous glucose monitoring device. It helps you track the blood sugar day and night
Yes.
through a sensor that's placed on the upper arm. And it comes with a reader, or you can use an app on the phone, and simply you just swipe to see your blood sugar instead of pricking your finger multiple times a day.
That's amazing.
And it's very convenient for the patient and also for the healthcare provider, because it helps us gauge the blood sugar control. It shows us exactly where the patient can improve. So it helps us a lot as healthcare providers as well.
Definitely, because I think a lot of us grew up maybe seeing our grandparents who have diabetes use the older machine, and we were all very scared of it. So I'm glad that things have really changed for diabetic patients. So schools are finally coming back soon. All the parents are getting ready, getting their children ready too for it. So can you give us some important back to school tips?
Okay, for parents who have children with type 1 diabetes, it's very important for them to send their kids to school with a kit or a bag of stuff that they will need on a daily basis or in emergencies. So that would include, of course, their insulin pens for when they're going to eat, a fast-acting carbohydrate snack like juice or candy or honey in case there are low blood sugar events. And of course, a glucose measuring device. So either the continuous glucose monitor or the finger prick in case they're going to exercise, in case before they eat, after they eat, in order to see the blood sugar in the long school day and keep track of it.
Definitely. So
and also, it's very important for the parents to be in touch with the school nurse and make sure that she's aware of the insulin regimen so that the nurse can help when necessary.
I think that's really great. I haven't thought of that personally, and the nurse does play a very big role when there's diabetic children in school. So that's the parents actually getting their children to school with everything they need in their school bag. What about the teacher's role that actually do have students with type 1 diabetes in class?
Yes, it's very important for teachers. First of all, the most important thing is to recognize the signs of low and high blood sugar. So low blood sugar would look like dizziness, inability to concentrate, shivering. High blood sugar would look like excessive thirst, needing to go to the bathroom, stomach pain, being very irritable.
Yes.
So once they recognize that these are important things for them to know, it brings me to a point where teachers should also know that children with type 1 diabetes should have unlimited access to use the bathroom or eat outside of allocated eating times, because their situation might lead them to that. So it's important for them to allow the children to do so. Another point that teachers should know is that children with type 1 diabetes shouldn't be restricted from exercising or playing as long as they have their devices, they have their low blood sugar snacks as well.
For sure, and it's definitely true that a lot of teachers don't let us, leave for the restroom or eat during class hours, because a lot of us used to use it as a way to get out of class. So I think it's really important that teachers do actually put into consideration any of their students dealing with this issue. So you're a pediatric dietitian at the Dasman Institute. Do you provide any courses over there?
Yes. We have a structured educational program for children with type 1 diabetes. It's called Kickoff. We brought it from the UK and adapted it for Kuwait. And it's basically a 4-day structured educational program, 1 day for the parents, 3 days for the kids. And anybody between the ages of 11 to 16 with type 1 diabetes can be eligible for the course inside Dasman, outside of Dasman. So anybody interested in learning more about the course, they can call the Desman Diabetes Institute hotline, and they can be asked to be referred to the kickoff team.
Perfect.
And we assess if they're eligible, and then we contact them into joining the course.
That's amazing. So through the course, they'll learn how to deal with type 1 diabetes,
yes,
for
how
sure.
to carb count, how to deal with exercise days, sick days, many pieces of advice that are very important in their daily lives.
And I think it's really important for the parents and the children. So finally, do you have any final advice for parents watching that are dealing with their children with type 1 diabetes?
Definitely. I think it's very important, although there are a lot of considerations to take when you have a child with type 1 diabetes, it's also very important to treat them normally, not to use language of pity or to treat them in the way that they can't do things that other kids can do.
Definitely.
It's very important to treat them like normal children.
Well, Reem, thank you so much for all your advice this evening, and you definitely helped us understand type 1 diabetes more this evening. Thank you for being with us.
Thank you for having me.
Thank you.